methods?
Yeah, so if you think there is pressure on a nerve, some structure pressing on that nerve, surgery is obviously an option to try and relieve that pressure. So, in one simple case, you can think of, for example, in the top left portion of this picture, you can see there's a nerve that's labeled greater occipital nerve, and it's passing through a muscle that the fibers of which go up and down, and that muscle is called the semispinalis. There's also another muscle on top of that that also often that nerve goes through called the trapezius, and that has a more kind of oblique orientation of those muscle fibers. And as that nerve passes through both of those muscles, it can get squeezed. And so when you have pressure on that, if you're able to identify that that is a nerve that's being irritated or compressed and causing your symptoms, and again, you determine that with a nerve block, as you mentioned earlier, you could theoretically remove a small piece of that muscle so that the rest of the muscle functions normally, but that nerve is now not being compressed by that other band that used to go around it. And people often say to me, why? You're going to start cutting into the muscles of my neck? Won't I have a problem moving my neck and so forth? And the answer is no. I've yet to see that in any of my patients, and it hasn't been described in any of the studies. And the reason is these nerves are not that large. And so we have very large muscles, like the trapezius, I think, is actually the largest muscle in the body. And the amount of muscle that we are removing is essentially akin to a muscle biopsy, which you can often do for many other conditions. And so we're just creating enough space so that that nerve can now glide more safely as you move your head up and down, or left and right, or from ear to ear. And that's one way in which the nerve can be compressed. Lisa, what do you think about that picture above the eye in the upper right-hand portion?
Yeah, so here is another site that nerves can get compressed. So you can see here, this is the eye, and then we have the eyebrow here. And the orbit is the bone that keeps your eyeball in place. And there is a nerve that travels through your orbit and then goes either through a little hole in the bone or through a little notch in the bone, and then travels up your forehead. Those nerves are called the supraorbital and supratrochlear nerves. And these nerves can get stuck here in the bone, or when they travel here in this little band, and we can release this band to help the nerve relax and to decompress the nerve. Also importantly, there's always these little blood vessels that are running with these nerves. And in a lot of patients who suffer from nerve pain and migraine, these vessels can be very large. And so, especially when you're having an attack, they can actually get very, very large, and they can start pounding. And I'm sure a lot of you have experienced that. It can happen here, right at the eye, but it can also happen in the back of the head, whereas you've just talked about. You can see there's a vessel here running with this yellow structure, the nerve, and also here at the temple, the nerve can run with a blood vessel. So, when you have these throbbing headaches, that might point towards that you have one of those blood vessels that's abnormally enlarged and might be pounding on your nerve, causing these symptoms. And then sometimes it's as simple as removing that vessel to help you improve your symptoms, which is something that can be done under local anesthesia in the office. And then maybe what I also want to mention, because, a lot of patients wonder if, this is brain surgery, or, if it's surgery that's very deep in the head area. But, the surgery of these nerves is actually done and performed right under the skin. So we're very far away from the brain, and we're doing surgery right under the skin. So it's safe, and it's surgery that can be done on an ambulatory basis, meaning you can go home the same day.